Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. AIIMS has decided to directly absorb postgraduates within the institutes to curb the severe shortage of doctors and faculty. In this regard, appointments will be directly made by the selection committee and ratified later by the AIIMS governing body as a move to streamline the recruitment process. Doctors have called for the abolition of the one-year mandatory rural service for the MBBS students. This has been demanded as the government is refraining from making permanent appointment of doctors in rural hospitals by forcing them to do a year-long rural service. In this regard, the union government is also planning to consider the rural service as an entrance test for the postgraduate courses in future. Medical interns from all over Maharashtra have gone on an indefinite strike demanding an increase in their stipend. This strike is to express their resentment in not receiving salary increment to Rs 11,000 from Rs 6,000 even after the revision was assured by the government in 2015. Recently, scientists have developed a new technique that captures 10K genes at once in individual cells. The technique, called Interns sequential fluorescence in situ hybridization, is a major advancement in identification of genomic activity in the cells. This technique can be applied to any tissue. Scientists from Rutgers University have developed a robotic device that can automatically draw and test blood samples, which according to them represents the holy grail in blood testing technology. The device consists of an image-guided robot that can draw blood from veins, a sample handling module, and a centrifuge-based blood analyzer. It is expected that the use of this device will improve workflow in hospitals as well as provide rapid test results in case of emergencies. Open-label phase 3 TONES 5 study results have demonstrated that solriamfetol, a norepinephrine dopamine reuptake inhibitor, reduces excessive sleepiness in adults with narcolepsy, obstructive sleep apnea, and Parkinson's disease. Out of the 643 patients that were administered solriamfetol, 458 patients completed the study. The Health Minister, Mr. J.P. Nadda, has announced that India is all set to start universal screening for tuberculosis and leprosy. At the age of 30, every individual will be screened not only for diabetes, hypertension and cancer, but also for leprosy and tuberculosis. 8 states and 4 union territories have signed MOUs with the Union Health Ministry to implement the National Health Protection Mission. The MOU outlines the role of central and state governments and union territories in implementing the scheme. It is estimated that the scheme will provide a health coverage to 10 crore poor families annually. World Sickle Cell Day is celebrated every year on 19 June all around the world to raise public awareness about the disease and its cure. In the light of this day, we have with us Dr. Rahul Bhargava sharing his insights with the community.
Today is a World Sickle Cell Day, and we know sickle cell disease is a congenital disease which comes from parents. There is no treatment or cure for sickle cell disease except bone marrow transplant. We know that not all sickle cell disease patients requires bone marrow transplant. For example, people living in Madhya Pradesh, Jharkhand might not require a bone marrow transplant, but people living in Africa like in Uganda, Nigeria, Congo, their sickle is more severe and they require bone marrow transplant. So in sickle cell disease, we need to understand the 300 ml of blood taken from their HLA matched sibling, brother or sister can cure sickle cell anemia. So let's fight this disorder. Be aware, pregenital screening for sickle cell disease. After marriage, before pregnancy, we should screen patients for sickle cell disease. And if you have a sickle cell disease, then ask about bone marrow transplant.
Thank you, Dr. Bhargava, for the message. We urge the community to share their valuable insights about this day. These were the latest happenings in the medical field brought to you by Docplexus. one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!